Hi, so I'm going to be showing you guys a number of skills that we learned this semester. So the first thing I want to start out with is check call care. The first thing you want to do is check the scene. You want to make sure it's safe, no hazards are around. Then you want to check your victim for consciousness. You want to ask him, hey, are you okay? But not only do you want to ask, you want to touch them. You're like, hey, sir, are you okay? Because if they can't speak, they might respond to touch. You might be able to see a response in their face or things like that. Then you want to do the head tilt, chin lift. You don't want to tilt it too high or have it too low. And then you want to put your 2 fingers on their carotid artery to check for pulse. But not only that, you want to lower yourself for 10 and do this for 10 seconds. Not only are you listening for a pulse, you're also listening for their breath. You also want to see if their chest is rising and lowering. That also shows that they're breathing. And then after all that, and you determine that your victim is unconscious, doesn't have a pulse, you want to grab somebody, let them know, hey, maybe call 911. My victim does not have a pulse or is unconscious. And then after that, you want to continue rescue breathing. So you also, with rescue breathing, you want to do head tilt, chin lift. You want to pinch their nose. Now, you want to put a seal over like a piece of plastic. You want to poke a hole so there's a little bit of a hole so you can get air in their mouth. But you want to put that seal on for, your own protection. And so we're going to pretend like I put a seal on top. Make sure you're doing the head tilt, chin lift. You want to do 1 breath every 3 seconds. So in my head, I counted 1, 2, 3, then 1, 2, 3. And you want to continue to do that for 1 minute. Now, let's say rescue breathing isn't really working. That's when you want to move on to CPR. All right, let me reposition my guy here a little bit. Reposition the camera a little bit too. So for CPR, you want to get on your knees. You want to interlock your hands like this. You want to go over. Now, what you want to do is 30 compressions, and you want to do them pretty fast. You want to get these compressions done in about 15 seconds. And then you go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 9, 30. Then after that, you want to do 2 rescue breaths. 1, 2. And you want to continue this. You want to do a few rounds. And if you notice that this isn't working, that's when you move on to the AED. So let's start using our imaginations a little bit. This is my AED. You want to keep it near you at all times. You do not want it on the opposite side of the victim, so you don't want to be having to lean over or go far to grab it. So you want to keep it right next to you. You want to turn it on. You want to wipe the victim's chest. You want to shave the victim's chest if they're hairy. Now, you want to place pad. I already placed them on here, but you want to place the first pad is the right one. And you want to put that on the upper right, and then you want to put the second one on the lower left. And you want to warn everybody when you're about to analyze and also when you're about to shock them. You don't want any phones or anything like electronic interfering with the AED, because that can really mess up the analyzation. Excuse me. And it can also mess up the shock. So you want to warn everybody, then you want to clear, and then you want to recheck for life. Are you okay? Are you alive? Well, don't do it like that, but you want to check for their pulse, check to see if they're breathing, see if you see their stomach rise when you go down low, and checking their pulse. You also want to feel if they're breathing on you. Okay, So the next thing that we learned was how to control severe bleeding. First thing you want to do is put on some gloves. Let me reposition my guy a little bit so I can show you a little way better how to do this. Okay, so you want to put on gloves. You want to take your pad, your gauze. Bleeding is in the arm. You want to press down, put pressure on it for 5 minutes. And then if it keeps getting saturated, you want to add more and more gauzes, but you do not want to take the first layer off at all. You want to keep this first layer on at all times. If it gets way too bulky, you want to take every layer off except the first one. You have to keep this on. So you want to tie off with a bandage. And you want to tie it off by tucking it under. So let's say you wrap, and then you, I cannot get this to tie. You want to tie it off by tucking. And then you want to recheck for circulation. And then you want to seek medical care after. So let's say this did not stop the bleeding at all. Then you want to make a tourniquet. So for a tourniquet, you can make one with a shoelace or a belt. I'm going to be using a belt. I honestly feel like a belt would be a better option because if you use a shoelace and it's too thin, it can end up cutting and damaging vessels. So you want to, hold on 1 second. Okay, so you want to place your tourniquet 2 to 3 inches above the site. You want to twist, and then you want to tie it down. And then you also want to use this as a last resort because this can be very tricky, and it can also, if you don't really know what you're doing, it can make the situation a lot worse. 1 quart for an adult is all it takes to have the body go into shock, and for a child, all it takes is 1 pint. So you want to keep that in mind. Now the next thing we're going to move on to is burns. Let me take this off real quick. So my victim has burned their arm. The first thing you want to do is cool it down with some cold water. So let's pretend like we have some cold water. You want to pour it over the top. That can help to cool down the area, obviously, and to stop the tissue from becoming more damaged by the heat. And then you want to cover it with an antibiotic cream. So let's also pretend like I have antibiotic cream for covering it. Oh, I forgot to mention before all this, please put some gloves on to protect yourself. And then you want to cover with a non-stick sterile dressing. You don't want to use a gauze for this because gauze will stick onto the burn, and when you go to take it off, it can make things so much worse. So you want to use a non-stick sterile dressing, and then you want to loosely wrap it. You don't want it to be tight because that can make things worse. And so you want to keep things loose, and you want to tie it off to kind of keep everything in place, the dressing and the antibiotic cream in place. Now the next thing